Hi there, everybody. So the title of this video is why you need manual lymphatic drainage after a cosmetic procedure. It's actually a trick question. Did you need to have a cosmetic procedure in the first place? Need might be an interesting word to use here. But I would say if you need an awesome end result, the answer is most definitely yes. And you definitely want to pay attention to this information. In the past, I have served in an advisory capacity on 2 post-op pages. So, somebody would come on the page, they would ask a question about the healing process specific to their surgery. And I would provide my professional advice or opinion or suggestions to that particular person's needs. And most of the time, the original poster of the question was really, really happy to get that information. It was the comments from other people, the arguments that really kind of blew my mind. People would say, oh, I never did any lymphatic drainage and I healed up just fine. Or, other things in addition to lymphatic drainage. It was like, oh, I never wore a faja and I healed up great. And then in all these situations, the poster would post a proof picture. Now, the problem arises is that in the proof picture, even without putting my hands on that person, I could see evidence of scar tissue, lumps, bumps, poor contouring, and so forth and so on. Now, these are not my clients. These women certainly didn't ask me for my opinion of their result, and it would have been hurtful if I had actually shared that. If they were happy with their result, then that's fine. But I'm here to tell you, if their choices had been different, the end result picture, the proof picture, would have significantly been different. Okay. The other thing is that, like I said, need. You can actually have a cosmetic procedure and not get lymphatic drainage afterwards. But if you really care about the result that you're going to get, then it is imperative actually that you probably do, appropriate aftercare. So, the other thing I can tell you is that I wasn't aware that I was getting a reputation for being somebody who was really good, and being effective working with scar tissue until I started getting women calling me up 1 year, 2 years, 3 years after their surgery saying, hey, I heard you were great with scar tissue. Can I come in to see you? In all of these instances, these women either got substandard care or they got no care at all. And, they wanted then to have some kind of better result. Well, I'm here to tell you it is much better to deal with your tissue issues when they are arising than it is, years past the development of them. Doesn't mean it's impossible to work some of that stuff out. It's just much easier. Okay, so I guess the best place to begin with why you would need lymphatic drainage after a cosmetic procedure is to talk a little medical stuff. So I'll try to be simple, and since I think in pictures, hopefully my words can draw a picture for you, although it makes me a little bit extra wordy, I've been told. Okay, so in your body, you have this thing called a lymphatic system. It is vital to your life. If that system shut down, you would actually die within 24 hours. Okay, pretty important system. It runs kind of between the cardiovascular system and the immune system, sort of sandwiched in between there. So the cardiovascular system is your heart, your veins, your arteries, and blood. The blood gets circulated through the heart or through the body because the heart pumps that blood through the body. Some waste and byproduct from the cardiovascular system feeds into the lymphatic system. But unlike the cardiovascular system, the lymphatic system has no pump. So the only way that lymph fluid moves through the body is with muscle contractions. This is really important, okay? So as you are moving, your muscles are contracting and they're actually pushing that fluid through your body, okay? Now, these lymph vessels that we have going through our body, you can think of them as like little tiny veins. They run just beneath the surface of the skin. So one thing to note about this is that lymphatic drainage is very light, it's rhythmic, it's hypnotic, and very relaxing, okay? Not painful at all. Okay, so you have these little vessels that run beneath the skin. They kind of travel all throughout your body, and they lead to something called a node bed, all right? So we have lymph nodes spread out through our body. We have an accumulation of lymph nodes in our neck. If you've ever gotten a flu or a cold, a lot of congestion, you may have noticed that your lymph nodes got swollen, okay? You also have lymph nodes in your axillary area, so in your armpit. We have a collection of lymph nodes in our stomach. Also, another main area for lymph nodes would be the inguinal area. So that's the area between, it's where your leg, your thigh meets your torso, okay? So a lot of torso node locations, all right? So the fluid, the lymph fluid flows through those lymph vessels. It goes to the node bed, and then the nodes filter it out for toxins and cellular debris, and then they eliminate it through this internal system that you already have in place. And that elimination takes place with urine output and through your bowels, okay? Now, when you have a cosmetic procedure, whether it's something simple like lipo or something more invasive like a tummy tuck, through the process of that actual procedure, the lymph nodes either get damaged or they get completely cut through, okay? In addition to that, when they do lipo, the surgeon will often inject something called tumescent fluid into your body so that they can actually perform the procedure. And lastly, because your body is inflamed from the actual procedure for a period of time after surgery, your body's actually producing fluid. Think of it like your body's trying to put the fire out, the inflammation, okay? So between the tumescent fluid, your body producing extra fluid, and then the vessels that would normally carry that fluid being damaged, you basically wind up with this accumulation of fluid with no way for it to get to where it's supposed to go for your body to eliminate it. That's a problem. Now, a lot of people will wake up from their cosmetic procedure and they have something called an external drain. So this is a plastic tube that has an opening inside the body. It's fed out through this little opening and it has a collection cup at the end. This is for the purpose of some of that fluid draining out of the body and getting rid of it. Typically speaking, an external drain is only going to be in your body for 3 days to, at the most, usually 2 weeks. And 2 weeks is actually a bit long to have an external drain. You have an opening that is a potential possibility for bacteria entering into the system. The other thing is that where that little tube comes out through the opening of your skin and your tissue, it's going to lay down scar tissue. Okay. So there are a lot of reasons that a doctor would want to pull the drains as soon as possible. And if you're watching this and you've already had a procedure and you've had external drains, you know exactly what a freeing moment it is when they finally take the drains out. They're a pain in the butt. Okay. Now, I'll do a little brief talk here about incisional draining. This is something that's pretty popular down in Miami. And so when incisional draining involves pushing the fluid out the cannula incisions, okay? And I will say that I've made another video that talks about this a little bit more in depth, but just so that you know, licensed massage therapists are licensed to work on body tissue. We are not licensed to work on body fluid. Incisional draining actually falls out of the scope of a licensed massage therapist's, our scope of practice. It's illegal. The massage therapist can lose their license. It's a $10,000 fine, plus court costs. Okay. There are reasons why you probably would not want to seek out somebody who does incisional draining. The little incisions that the cannula goes through, typically speaking, your body's going to heal those up in 24 to 72 hours after your surgery. And the reason for this is that the body wants to protect you from outside invaders. If the therapist is opening up those incisions for the purpose of pushing that fluid out, then that means your body has to lay down another layer of scar tissue, and then another layer and another layer. And so for those reasons alone, you would not want somebody to be pushing fluid out of your body. Okay. And again, your body is already equipped with a system in place to handle the excess fluid. Okay. And that's where a lymphatic drainage professional comes into play. We manually manipulate the system and we push that fluid, and push, just so that you know, is a directional term. It is not a pressure term. We push that fluid to the node bed so that your body can then take care of it and eliminate it through the system that is already there. Okay. So that's physically and medically, mechanically, if you will, what goes on and why you would need lymphatic drainage after a cosmetic procedure. But it doesn't actually just stop right there. Okay. So anytime somebody comes in to see me, no matter whether they're, the first day after surgery, all the way up to, 12 weeks or so after surgery, the basis for every single session is always going to be manual lymphatic drainage. But then there are other things that happen during the course of the healing process. Tissue issues develop. And these can develop by no fault of your own, no fault of the practitioner, and so forth and so on. Certain things that would cause tissue issues to occur would be ill-fitting garments, not wearing your garments, poor hydration on your part, or let's see, what else? Darker pigmented skin is it just makes you a little bit more susceptible to developing something called fibrotic tissue. Darker pigmented skin people are more prone to developing fibroids. So the two kind of go hand in hand. So you want somebody who actually can help you prevent those things from occurring. But if they do occur, then you want that person to be able to handle that development, okay? Because you don't want to be in a situation where you've got the right shape that you were going for, but your skin is hard and lumpy and bumpy and does not feel human when you actually touch yourself, okay? Another thing that an experienced post-op practitioner should be able to do would be working on the actual scar itself. So if you've had something a little bit more invasive, like a tummy tuck or breast augmentation, then you've got a longer incision line. Obviously, you can't come right out of your surgery and have somebody work on that. You have to wait until a certain amount of healing has occurred. So, but once that process or that time has come, then you want that person to be able to work on that tissue so that ultimately, you have a really faint incision line that when you run your fingers across it, you can't even actually tell that something happened there. Okay. In addition to, say, fibrotic tissue and then the incision scar tissue that needs to be dealt with, there's other tissue issues that also need to be worked with. And this is where we talk about fascia. I give all of my post-op clients a fascia lesson. So here it goes. Again, getting back into some medical stuff, but I'll try to make it real easy and give you a good visual. Every single person I know has handled a raw chicken breast. Okay. So you have the skin of the chicken, you have the meat, the actual muscle of the chicken, and in between is this really thin, opaque membrane. Okay. That's fascia. Now, just like the chicken has it on the chicken breast, we actually have it all over our body. It is a connective tissue, just like muscles and ligaments and tendons. Now, if you were to look at that tissue under a microscope, you would actually see that it's two layers of tissue. There's a layer of collagen and a layer of elastin. And those two layers of tissue are actually supposed to slide across each other. They're not supposed to be stuck, okay? Not to themselves, and certainly not to the musculature. In between the two layers of tissue is something that we call ground substance. And ground substance works like Jell-O, in that when you warm it up, it liquefies. Okay. Now, how does this affect you and your post-op body? So here's another little visual of how fascia works in the body. Have you ever gone to reach for something and you go to extend your arm out, and before you get fully extended, you get like a hitch in your shoulder, and your arm doesn't want to go the whole way out. And so you have to almost like pull the arm back and kind of, readjust to get to full extension. So what's actually happening there is that the fascia has locked down on the muscle, and it doesn't allow the muscle to go through its full range of motion, which is a problem, okay? So that's where the myofascial modality comes into play. Now, where fascia is tight and or restricted is diagnostic. It shows you that there's a problem or there's been some trauma or some injury to the underlying tissue. Now, with the cosmetic procedure, obviously there's injury and trauma to the tissue. So not only do you want to look good after your surgery, not only do you want your tissue to feel really good after your surgery, you want to actually be able to move your body freely. You don't want to be stuck and unable to move your trunk, or you don't want the tissue so tight from your breast augmentation that you can no longer extend your hand and reach something on the second shelf in your kitchen. These are all important things that go into post-op work. So it isn't just lymphatic drainage. Okay. I want to make a little mention here. I think I overlooked saying with when I was talking about what happens in your body. And if I already said it, this is good for repetition. It takes 3 full months for those little tiny lymph vessels to heal up. Okay. So again, if your doctor's pulling the drain at 3 days or even 2 weeks, what is going to help your body eliminate that excess fluid for the remainder of that 3-month time frame? Okay. All right. So, looking for a qualified manual lymphatic drainage therapist. Again, you're looking for somebody who's been educated. I will tell you that in massage schools, typically, they do not teach lymphatic drainage. It's something that you actually have to go back for and study, like as a continuing education program. I have studied both the Vodder method and the Chickley method of lymphatic drainage. So there's more than one school of thought when it comes to lymphatic drainage. There are nurses who will take lymphatic drainage also as continuing education. They want to work with cancer people, and then some of them do some post-op work. This is the only place where I think that it's important to look at this, because I've already talked about how much damage is done to the underlying tissue and how much therapy is actually needed for that tissue. A massage therapist is specifically skilled, trained, educated, and experienced in working on tissue issues, whereas a nurse is not necessarily going to have that experience and education. Okay. All right. So I work from my home office. Picture in the background here. This is the front room as soon as you walk into my home. It's licensed and inspected by the health department. It's also incredibly private. I only say this because, when I work on clients the day after their surgery, And these women, you know, they're lucky if they can get up and put on a bathrobe, you know, and they've got drain tubes potentially hanging out of them. I can do lymphatic drainage even if you have an external drain. Okay. So, but the point is, they appreciate the fact that my location is private. They don't want to be seen by anybody, you know, so that is certainly helpful. I do serve, yeah, I'm here in Riverview, but I serve clients from Riverview, Apollo Beach, Sun City Center, Waimama, Fishhawk, and Brandon, for the most part. Okay. Every session I do is 90 minutes. That gives us plenty of time to do lymphatic drainage. It gives us plenty of time to do coaching on your garment wear and also address any tissue issues that may arise. You can find me at annabasslmt.com. I'm also at tampabay-massage.com. And if you have any questions about anything that I've shared, you can reach out via text or call me. My cell phone work number is 412-328-4540. I have seen firsthand what happens when you either do not get care or you don't get appropriate care. And everything that you do on the backside of your surgery truly will make or break your overall end result. It is a good investment considering everything that you have put into, you know, deciding what procedure you wanted to have, where you wanted to go, who the doctor was. The after surgery decisions actually are vitally important to the final end result. And I actually really enjoy helping everybody get the body that they want. Okay. So hopefully this has answered some of your questions. It's helped you make decisions about whether this is something that you want to do as far as your care. Okay. All right. Thanks a lot. Have a great day.